Disclaimer: this video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, let's dive into a really fascinating medical mystery. I'm talking about a situation where the body's signals get completely crossed up. It's a condition that basically flips a totally predictable biological response on its head. And in doing so, it gives doctors this critical and super unusual clue to solve a much bigger puzzle. Okay, so think about the last time you had a fever. You know the feeling, right? You're hot, you're exhausted, and your heart is probably just pounding in your chest. That's totally normal. But what if it wasn't? What if as your temperature shot up, your heart did the exact opposite and actually started to slow down? Weird, right? And right here, this is the core of the mystery laid out perfectly. So on one side, you've got the normal response. Your fever goes up, your pulse goes up with it. Simple, makes sense. But then you look at the other side, and that's the paradox we're talking about. The fever is climbing, but the pulse, it's dropping. This totally bizarre mismatch is exactly what we're going to unpack. So to really get why this is so strange, we first have to understand the rule. The medical rule that this whole phenomenon just completely shatters. Okay, so doctors have this thing they rely on called Leibmeister's rule. Think of it like a fundamental baseline, a predictable guide that helps them figure out just how sick someone is and fast. And the rule is pretty simple. For every single degree Fahrenheit your temperature goes up, your heart rate should also go up by about 10 beats per minute. It's a really simple, usually reliable calculation. But, as we're about to see, not always. Yeah, so our story actually starts way back in 1858. There was this French physician, Dr. Jean-Charles Faget, and he was in the middle of treating patients with yellow fever. And he started noticing something odd. His patients had these raging fevers, but when he checked their pulses, they were just strangely, unexpectedly slow. He was the very first person to officially document this bizarre exception to the rule. And so, naturally, the phenomenon was named after him, Faget's sign. You might also hear it called by its clinical name, relative bradycardia. It's basically the official term for this exact situation, when a patient's pulse just doesn't speed up like you'd expect when they have a fever. Okay, so let's make this super concrete. Imagine a patient walks into the ER and they have a pretty high fever, right? Let's say it's 102 degrees Fahrenheit. Now, based on everything we know from Leibmeister's rule, their heart should be racing. But instead, the doctor checks their pulse and finds it's only 50 beats per minute. I mean, wow. That is shockingly low for a fever that high. That stark contrast right there is Faget's sign in action. And it's an immediate signal to the doctor that, hey, we are not dealing with a typical infection here. So if this sign is a clue, where does it point? Well, that brings us to our list of unusual suspects, the specific infections that are known to cause this very strange sign. Now, what's really interesting here is the sheer variety. This isn't caused by just one kind of bug. You look under the viral causes, and you've got the classic one, yellow fever, but also things like dengue and Colorado tick fever. Then you jump over to bacteria, and the list includes typhoid and Legionella pneumonia. It even shows up in some parasitic infections. So this is definitely not a random thing. It's more like a specific calling card for a very select group of pathogens. All right, so we know what causes it, but the next big question is how? I mean, how do these tiny little invaders actually manage to hijack the body's pacemaker and force the heart to slow down, even when the rest of the body is in total overdrive from the fever? Well, researchers have figured out a few ways these pathogens can pull this off. First, they can release these inflammatory signals. They're called cytokines, that basically just scramble the messages that are supposed to be going to the heart. Another trick they have is to activate the body's emergency brake nerve. That's the vagus nerve, which, you guessed it, slows the heart down. And in some cases, some of these pathogens can even directly attack and weaken the heart muscle itself. Pretty clever in a sinister way. Okay, so this all leads us to the most important question of all, right? Why does any of this matter? I mean, beyond being a cool medical curiosity, why is this paradox such a critical clue for doctors on the front lines? Well, the bottom line is this. Faget's sign is an incredibly powerful diagnostic tool. For a doctor, seeing this sign lets them immediately narrow down the list of potential culprits from like hundreds of possibilities to just a short list of our unusual suspects. Think yellow fever or typhoid. And maybe even more importantly, it's a huge red flag. It warns the medical team that this infection might be directly attacking and damaging the heart. At the end of the day, it's just a powerful reminder that the body is always telling a story through its signs and symptoms. A doctor's job is to read that story, and a fever with a slow pulse, that's a crucial, really telling chapter that they absolutely cannot afford to miss. It really makes you wonder, doesn't it? If something as simple as a pulse can reveal so much, what other secrets are our bodies holding, just waiting for us to figure them out? Something to think about. Thanks for diving into this with me.